I'm Dr. Dennis Doss. I'm a board-certified plastic surgeon in Beverly Hills, and I specialize in facelift procedures. Now, you should consider a facelift when you have some signs of facial aging that bother you. And the typical places that you notice it first are the eyes and the neck. So women who are noticing facial changes in their eyes will notice that when they put their eyeshadow on, it starts to cake. That's an early sign that you may need a blepharoplasty to address the eyelids. In the face and neck, you may notice some early jowling, or it's just not as tight as it used to be and the definition is gone. A facelift will address that, and you may be a candidate for that. Now, I customize my facelifts based on the concerns that my patients have, and also on maybe the different age of the patient and the severity of facial aging. Now, we've been seeing a lot of patients coming in sooner, like in their late 40s or early 50s, to address these issues because they want to sort of turn back the clock earlier so that their friends don't notice that they've done anything, but they can still look beautiful and youthful. And these are good candidates for maybe a more modest procedure or a mini facelift to address these issues. This is an example of one of my patients in her mid-40s who was troubled by early signs of facial aging. And the things that we notice are she's got some early signs of excess skin on her upper eyelids and then some mild jowling. These areas really bothered her a lot. And then she also has the laugh lines that she'd like addressed, and then also just the general quality of the skin. Now, so all of these things were addressed with a facelift procedure. I also restored volume in her cheeks with some fat transfer, and I addressed the upper eyelids with an upper lid blepharoplasty. The facelift also addressed the early jowling, and the skin was addressed with a CO2 laser to remove a lot of the sunspots and also tighten the skin. Now, in this view, you can really appreciate the improvement in the jawline, how the jowls are improved, and she's also got a really defined jawline. In the eyelids, the excess skin has been removed, and the eyes look more open and more youthful. You can see that the volume has been restored in her cheeks with the repositioning of the facial tissues and skin, and also, in addition, I transferred fat to restore the volume in the upper cheeks. Fat was also transferred to the laugh lines, so not only was the facial tissues repositioned, but fat was transferred to the laugh lines to really improve the laugh lines a lot. The CO2 laser makes the skin look very clear, very fresh. The scars are well hidden along the ear and then back into the hairline. And this is a 1-week result. You can already see that the results are already very beautiful.